tell the patients who are in active treatment and who plan to get the vaccine? Just continue as normal after they get it with all the appropriate cautions?
I think there's one other important aspect, which is what is the right timing to get a vaccine? And that is a question that often comes up. So patients who are not getting active treatment, there is obviously no concern. Whenever their name comes up, go ahead and get the vaccine. And the second is, what if someone's actually getting active treatment for their cancer? Is there any role in terms of trying to time the vaccination with respect to the doses of the medications? And for most of the treatments we are using for cancer, there is no clear guidelines in terms of, there are no clear guidelines in terms of when we can get the vaccine. There have been several guidelines that have been put out by different organizations. The bottom line is, if there is an ability to space out or give some time between the vaccine and the dose of the medication, do that. Don't modify your treatment schedule just so that you can get the dose at a particular time. The only place where we would recommend specific guidelines would be in the context of somebody who may have had a bone marrow transplant or had some kind other kinds of cellular therapies. In those contexts, we often recommend that we wait for a couple months after the stem cell transplant before we get the vaccines. But for all the other treatments that we are getting right now, we want to, just within the schedule of the treatment that's already ongoing, try and get the vaccine in between two doses when feasible.
For those who have been vaccinated and are living with cancer, you spoke to that in great depth, but I'm also wondering about people that are perhaps in post-treatment. And let's look at social distancing measures or other restrictions. Are those different for patients versus the general population?
No, I think the precautions are the same. I think the social distancing and the masking should continue to be observed the same way. And I think the only other word of caution, I think maybe particularly relevant for the cancer patients would be, again, trying to avoid, those kind of being outdoors in a larger group of people, even if when you maintain the social distancing, try and not do that. The outdoors are probably a little better than, smaller indoor gatherings. And it's mostly the common sense precautions. And I think, the cancer patients are probably more tuned to these because they have been following some of those things even before the COVID came on. And post-vaccination, I would recommend that these steps don't change at all, partly because, again, for a given person, we don't know how robust immune response that those patients have had to the vaccination, and the lack of good testing to say that, okay, now you are fully vaccinated, your response is great, you don't need to worry about getting infected.